Hi there, my name is Mia. I have been a nurse for 7 and some change years. I have had a lot of different experiences. I graduated from with my bachelor's in 2013 and went straight to rehab nursing for just a few months, 8 months, and then went to cardiac and had a very about 4.5 years of cardiac nursing, starting in the progressive telemetry units, and ended up in like the CVICU at a level 1 trauma hospital, and got so much incredible experience there. I then went to PACU, pre-op PACU, and really enjoyed that time. It was kind of like a breath of fresh air after those years of CVICU. Then decided to travel back in the ICU setting for 2 years, and ended up back in Lincoln, Nebraska, and have been in their float pool ICU, and I also do case management, just for something different. I like to mix it up. I've had all sorts of, various opportunities within different hospitals, like wound clinic nursing, HBO unit. So I've had a lot of varied experience, which I think has really helped to shape my perspective on what nursing is and what we can do and where I kind of want to go as a nurse practitioner. With evidence-based practice, aside from what we've learned in our undergraduate programs and those studies, that research course, I use evidence-based practice every day in our healthcare settings, from Foley insertion, using CHG, and how to care for central lines, goes on. Those are all examples of how we use evidence-based practice every day. As far as doing the actual research of evidence-based practice and implementing it, I've had limited experience with that, but I hope to get a lot more experience in that area. One of my passions in nursing and in healthcare in general is integrative medicine and integrative practices using complementary, alternative, I don't really like to call it alternative. I really think they can all complement each other into an integrative healthcare system where those modalities are used. Things such as essential oils with aromatherapy, massage techniques, and the list kind of goes on. I would love to do a capstone research project specifically looking at essential oils in the acute care setting. I know it's used in clinics and other patient healthcare settings. I would like to look specifically into acute care settings, though, as I feel like they could really benefit both the patients, families, and the nurses in that environment. Let's see, some personal items about myself. I enjoy traveling. I love music. I am a concert violinist, and I've actually played in Carnegie Hall quite a few times, and was fortunate enough to spend 5 years just traveling the world, and went to many continents and countries, and I love to garden and can, and my husband and I and our little baby are in the process of homesteading, if you will, and so it's just a real adventure. So I'm very excited to get to know you guys, and look forward to seeing some familiar faces and names, and as we go through this course. So cheers.